might be reflected in the clock. Thanks, Clark.
I've listened carefully to what the Minister has said, and unfortunately I missed the beginning of the debate because I actually have come direct from one of the new walk-in test centres in Finglas, and before it opened at 11 o'clock there was already a queue of people waiting. And yesterday we received briefings from suppliers of antigen tests about the availability of antigen tests. And what I would say, Minister, is both in this case of the walk-in test centres and in the case of antigen tests, I believe frequent testing is going to be a key part of how we move forward in a vaccinated world. We've seen how out of 11,500 people tested last week with no symptoms, nearly 350 of them were tested positive with COVID. So we know that frequent testing, rapid testing are all extra tools. No silver bullets, but all extra tools in the process. Can I say on the vaccine prioritisation, look, I have I listened to people yesterday. They're really frustrated. They're really disappointed that they thought they were getting a vaccine at a certain time and they're not. And if the science has changed, yes, there's a report on the NIAC website, but you know, it takes a lot to get your head around some of those scientific reports. What I'd ask, Minister, is that we would have a recorded briefing from NEFIT, from NIAC and from the HSE, that every one of those key workers is able to watch in a 5, 10, 15-minute briefing online that explains that to them. Because if the science has changed, and I spoke to one teacher yesterday in their 20s, and yes, their father was a bus driver in his 50s, and he said, look, I'd far rather my father get it. And don't forget, there's been a lot of talk about different categories, but public transport workers and food supply workers were actually a category above those in education. And they're even more disappointed, and yet I have not heard the same level of discussion about them. Bus drivers are at real risk. We saw in London how they really suffered. So, Minister, there are groups out there. We need to explain to them why it has changed. And it did come quick. You've accepted that yourself. So we need to give people the information in a way that they can digest it in their own time. Can I say, just on the final issue, on the issue of vaccines, I know you're reluctant to give deadlines, but if you could outline to us when the Janssen vaccine might be arriving, I think that would be a key tool in the vaccination process. And I do hope more people get vaccines. I think the vaccination programme is going to be the real test for this government over the next 2 or 3 months. We have promised that once we have the delivery, we will deliver, and I promise, Minister, that we need to do everything in our power to make that happen.
Thanks, Deputy. Minister, remaining time is yours.
Thank you very much, Chair, and can I thank the Deputy for his questions. The walk-in PCR testing centres, which we initiated recently, have proven to be very successful. And as the Deputy has quite rightly said, it's for asymptomatic or people who do not have symptoms of COVID, because if you have symptoms, you should call your GP and you'll be referred. And it has picked up hundreds and hundreds of tests. And the feedback is very strong. We're hearing from people who are saying they just went down to check. They didn't for a moment think that they were positive, but that there are people vulnerable to COVID in their lives. They wanted a double check, and it turns out that they are positive, and now they're going to follow the protocols and keep themselves away, thereby protecting their friends, protecting their family. And as the Deputy will be aware, we've opened up, or we are opening up one in his own constituency, and I want to pay tribute to the National Ambulance Service for being able to move so quickly. I want to see more and more of these, and we want to see them deployed in areas where the COVID rates are very high, and the response has been very good. Can I share the Deputy's passion for rapid testing? I want to say again that there are highly credible, highly respected people on both sides of this debate. Some are very worried about the potential negative effects of rapid testing, whereby they are not remotely as accurate as PCR testing in terms of identifying positives. There's a real concern that for some people they might get a negative test result in spite of being told that a negative test result, it may or may not mean that you have COVID, because it's not as accurate as predicting whether or not you have COVID. They may take it that they are negative and then engage in higher risk activity, misunderstanding the test result. And there are highly credible people who are genuinely concerned about that, and we have to be very clear that we are communicating appropriately and people understand the limitations of the rapid testing report. However, as the Deputy will be aware, I appointed an expert group led by Professor Mark Ferguson to look at this. The report is more positive of rapid testing. It is making some recommendations. and I'll be launching that report later on today, and then working with Cabinet colleagues to look at a rollout of rapid testing in the various sectors. Minister McConalogue and I, for example, are already involved in a large-scale pilot in meat processing plants where there are tens of thousands of rapid tests being deployed in that sector, and we'll be looking at doing more of that. I think the Deputy's suggestion of a video briefing on the rationale behind the prioritisation based on age is an excellent one, and one I'll take back to the department today, because the conversations I've had with people in the education sector, who of course were feeling disappointed, but the conversations I've had with them when they hear the NIAC analysis, when they hear that someone who is in their early 60s, and to the Deputy's point, that might be their mum or their dad, is 70 times more likely than they are to die from COVID. The response, certainly that I've had from all of them, is, look, if that's the case, if the risk is so much higher for the older age groups, then please vaccinate them first. It might be my work colleague, it might be my parent, it might be a friend, it might be a family member. Please protect them first. It's worth saying as well that NIAC looked at any potential link between risk of severe illness and death and sectors. So they looked at the education sector, they looked at construction, they looked at healthcare, they looked across the sectors. The only sector that they found which had a significantly higher increase of harm from COVID was the healthcare sector, and that the healthcare sector has been prioritised. Finally, to the Deputy's question on Janssen, I authorised the use of Janssen yesterday in regulation. We are expecting Janssen to arrive in late April. I think it's a very interesting vaccine. It'll be the 4th vaccine we have. The clinical trials are showing really high levels of effectiveness and protection, which is very, very encouraging. And also, Janssen is the only vaccine that we currently have advanced purchase agreements in place for, which is a single-dose shot. That makes it particularly useful, for example, if we're trying to engage with harder to reach communities. So, as the Deputy will be aware, one of the groups that NIAC has pointed to is those who are homeless. Obviously, many people are homeless, are leading very, very difficult lives, sometimes chaotic lives. And the Janssen vaccine, I think we'll have to wait, obviously, for the clinical advice from NIAC, from the HPRA, but I think it's a very interesting one to be able to use for people who are in more vulnerable situations, who might find it harder to be able to come back to a vaccination centre or a GP clinic in exactly 4 weeks or 6 weeks or 12 weeks. So I'd like to thank the Deputy for his comments and for his suggestions.